Hi, everybody. This is Talking About Stem Cells. My name is Shara Reiner, and I am a cord blood bank nurse, and we are on a journey to talk about stem cell treatments. And we are again here with Dr. Alexandra from Swiss Medica. How are you, Doc?
Thank you. Everything is fine, and thank you for your interest for a new topic today. We will talk about exosomes, right?
Yes, so today we're talking about exosomes. What are exosomes? How do we use them? Can they substitute a full stem cell therapy? And many other questions that people ask me all the time. So I have to say that when we first started our stem cell therapy journey many years ago, exosomes were not a thing. They came to the picture much, much later. And when we first met exosomes as patients, we did not understand what they are. And I think many of the people listening today don't understand exosomes. So let's just give a quick summary. What are exosomes?
Okay, good. So, yes, you're absolutely right. If we look at chronological line, stem cells appeared roughly the middle of the last century, and exosomes appeared quite recently. And first of all, we need to be aware of the fact that they are very, very similar to the effects of the stem cells, because if you look at this picture, please look at your left at the bottom. You see the word cells. That is actually mesenchymal stem cells. We spoke about it last time, and in spite of many, many positive effects, stem cells is also a factory where the exosomes are produced. So, in a simple words, we can say that the exosomes are daughters of the stem cells, which are much, much smaller in size. They don't bring genetic information, but effects are pretty much similar.
So if I look at the exosome structure, what's in there?
Well, that is a very good question. That small orange circles, when they leave the stem cells, you can see that oval structure. And inside, there are lipids, proteins, nucleic acid, mitochondria. You remember that is energy for each cell, and parts of RNA. It doesn't contain genetic information, which is good. It's easy to obtain, yeah, these exosomes, because automatically they are produced, and they help cells to communicate with each other. They are like delivery molecules that brings information from one part of the body to another.
And I think many people don't understand how you make stem cells and how you make exosomes. So stem cells are made in cultures. So if you've learned basic biology, you know how you make cultures and then they grow and you move them to the next dish and then they grow. And that's what we call phases. We spoke about that last time. But how can you make exosomes?
Well, usually the specialists need 72 hours for one dosage to be produced. Let's say we harvest stem cells, right? That is a natural process. We create all necessary conditions for the stem cells to grow, and automatically, meanwhile, they produce these exosomes. Okay, so in the liquid where they are, so they emit those exosomes, and then our specialists collect them, those orange ovals or circles, and that is what we need. And definitely, depending on the way of administering, the purity of that, liquids can be different. For example, they can be done as intravenous infusion, as IV drip. We need it very pure form, right? And also there are forms for eye drops with eye problems, or can be masks for face for anti-aging, right? For clusters with intestine problems, and even intra-articular, these exosomes can be done, and into the spinal liquid. it. So actually, as you can see, there are a lot of ways where they can be used and administered.
So, just so I understand, when we make exosomes in a lab, we grow the cells, and then the cells secrete these exosomes without anything that the lab technician needs to do because this is a natural process. And then the lab technician can separate the exosomes and the stem cells. So we can make from one product that we are making two different products. One is exosomes and the other is the stem cells. And those cells will continue growing and developing and making more exosomes or more cells, depending on what we're doing. And so we're basically getting exosomes as byproduct of making stem cells.
Yes,
And
you're
then we
right.
can
Very
take them.
simple.
Yeah, and I'm a fast learner. And then we can take these exosomes and prepare them in different ways so we can administer them differently.
Yes.
Oh, you
And
say
very
that.
important thing I have forgotten to mention inhalation as well.
And I think inhalation must be the most popular way to give exosomes because almost any clinic I work with and any protocol these days does contain exosomes inhalated, especially for small children. And I have to say, it was really tricky for me to teach my youngest or my kids when they were younger to take inhalation. They're not comfortable doing it. Now they are. So my older kids, they sit down with a mask. I have pictures of them sitting down and doing exosome inhalation treatment. But with many, many young children, which automatically we would assume it's easier to do exosomes for them, right? It's not so easy to do. And
Right.
then we give them the same medicine, but in nasal drops, which I've done myself. And I have to say, it's not a comfortable thing to do. People don't like doing that. But it must be the most popular way to do stem cell therapy using exosomes. And it takes a moment to think about it. Are exosomes stem cell therapy?
Well, as you could see from that picture, let's say they are with components are very, very similar, but in terms of efficacy, and duration of the effect, that is a difference. For example, the exosomes effect maximum can last 2, 3 months, right? Their priority is that they work immediately, right? First days and weeks. So when patients say, okay, we feel this or that, and those changes they share with us, definitely that is due to the exosomes effects, because for the stem cells, it takes time, right? Like 1 month, 1.5 months to show their significant effects. And the stem cells, you remember, they can work from a several months period to several years. So that is priority of the stem cells. Long-term effect, right? From several months period to several years, and but this effect goes up very, very slowly in comparison with the fast form. I call them just the first aid, right? They are trying to help us immediately and for short period of time.
And I think it comes out of what you're saying that can exosomes be a singular treatment? Can we just do exosomes and skip stem cells completely?
Well, you see, the ideal version, to my mind, is a combination, right? Combination of the stem cells and exosomes. When patients are coming for this or that program and they receive that like full package, and at the end, according to the problem, they can have exosomes as post-treatment period after the main therapy. It's also important, right, to maintain regeneration on a high level. But of course, we are in medical field and we are aware of the fact that not all patients for this or that reason can come to us. For example, very advanced, severe situations, right? ALS, when patients cannot travel and cannot breathe properly, etc., or the child with severe epilepsy and they cannot come as well. So they can have at least some forms of the exosomes, possible nasal spray or inhalation, and that is like a fast support can bring the body a new stimulation, a new trigger with energy and building stuff.
So when I have a patient that is not able to travel for many reasons, if I want to try exosomes as a first aid to see if it helps, and this patient comes to me and they say after a month or 2 months or 3 months, listen, this didn't work for me. It did not make the effect that I was thinking that it's going to make for me, or I'm not doing any better, or even I'm doing worse. Does that mean that if they come for stem cell therapy, so the full package, that means, will it be like an indicator to do or not to do treatment, like a full treatment?
Well, you see on invisible level, on molecular level, like you see at this picture, the blue-colored target cells in the center, that is the target cell where all components of the exosomes will come to. And all the exosomes have, they will donate to target cells. And definitely there are consequences of this interaction which are scientifically proved, and on your right, you can see those effects. So we can have, for example, more functional cells. In this picture, these are neural cells. We can have more connections between neurons, better vessels growth, yeah, capillaries and circulation finally, and it helps to suppress neuroinflammation. So definitely all this process will take place, but the range of them, it can be different. And there are some cases when patients say, okay, the effect is minimum, but it doesn't say, okay, it didn't work at all. On invisible level, there are positive things. Even immune system can be stronger and so on. But these, let's say, minimum effect, it's not the final conclusion that the stem cell therapy won't work as well. We can try if the patients can come to clinic, right? We have concilium, we discuss each severe patients together, and we make final conclusion, okay?
I see. I think it's really important to understand that sometimes when we take these kind of therapies, we don't know how to measure the success because some of the things that happen in our body are concealed. They're not something that we can visibly see or even feel, but they are still happening. And maybe the amount of treatments are not enough, or maybe there's so far the treatment can take us. But these effects that we can see on the board here, the neurological damages that can be repaired or replenished, and the vascular issues that can be repaired, we don't feel when our vascular issues are being repaired in our body. We don't feel it physically. We can maybe see the effect. So, better mobility, less muscle pain, more function, but we can't feel a vessel being repaired in our body. We don't know how to estimate it. And I think most of the patients that I speak to, they say, oh, this didn't work for me. I tried it, it didn't work for me. They don't understand these things that a big part of our body's functions are things that we can't measure or we can't measure with standard tests. So I can measure vascular repair, but I'm going to have to do a very invasive procedure to measure it. And I think that's part of the problem. Part of the problem when we explain it to patients that it's not something that they can understand. So speaking about it and showing how it works is really, really important. And when we make the comparison between exosomes and full cell treatment, I think that's the easiest way for people to understand full cell treatment. So whole cells that are being given to you. I think most people don't really understand why is there a difference because in my mind, stem cell therapy is like, okay, there's the cell and it has these little soldiers inside that it spews out and they go and they do their thing. That's how I thought about stem cells before I started working in the field. So What's the big, like, how do they work differently? Do they really work that way where the cell secretes these exosomes and they do what they do? Or is there a benefit to a whole cell injection?
Well, I can tell you, you see, especially for categories of patients, I think, who cannot come, that is at least can be solution. Or if the family wants to try, okay, at least one small step in regenerative therapy, that thing can be an alternative. You see, I communicate with patients after the therapy, and very often they say, look, you see, I have more energy, more stamina, my cognitive skills is much better. I have another level of energy and I feel that I function much, much better. Or if the sinusitis after the nasal spray completely disappears, or when people with respiratory problems say, look, we have less episodes with inflammation, and we see that the inhalation with the exosome, they help quite significantly. So, of course, these things are good to hear. They inspire patients to continue. Or when autistic kids are becoming calmer and behaving absolutely in another way, some families booking those exosomes from time to time during the year because they really see that connections when they started exosomes and that the child is absolutely different. So, to my mind, ideal combination is stem cells both and exosomes because of the different beginning of the effect, right? So first exosomes, then goes stem cells effect. That is the ideal combination. But if no other options, even this monotherapy, yeah, like therapy with any kind of form is good.
So they don't replace each other, they complete each other.
Yeah, I should say they complete each other. Yeah, they go like mother and daughter, let's say together.
And I want to talk a little bit about autistic children because I have some of those at home, just a few. My oldest, he's done multiple rounds of stem cell therapy. He's done 7 full rounds of what we said, so cells and exosomes. And in the last 2 years, we've only done exosome therapy for him. And I have to say that I find it amazing for him. He does not like the needle, and he has to have an IV when we do full cell therapy. And he's willing to sit down with inhalation. And we just came back a month ago from Swiss Medica and we brought for him treatment back home. And I see amazing results just with exosomes with him. Granted, he was given basic therapy for many, many times. I think he's maybe Swiss Medica's stem cell therapy champion at this point, that child. 7 rounds, it's not a small amount. But I do see very good results just with exosomes. And he's turning 13 in the summer. I know, can you imagine? He was just a toddler when we came for the first time. And I feel like we're coming to the end of stem cell journey for him, but I still see an effect of exosomes. And whenever we give him exosomes, he moves forward. He gets more speech abilities, more confidence, more ability to explain himself and fend for himself. And I keep wondering when we look at autistic children, and I think maybe we'll have a long session about autistic children in the future and we plan long-term therapy. And I know lots of your patients, they come and we say, okay, this patient, he's going to be here for a lifetime or for a very long time because their illness is such an illness that requires them to show up every so often and get a booster so they can continue life as best that they can. But when we talk about autistic kids, especially like my oldest and my youngest, so my two middle kids, they've done their stem cell therapy. They're going to move on to have normal life, whatever normal is. But my oldest and my youngest, they are more complicated patients, just, because of their history and their past medical issues. And we look at these kids and we think that these children, they're going to be treated for a lifetime because it helps them live. It keeps them balanced, it keeps them moving forward, being able to function. Can exosomes be a permanent medicine for them? So they come every few months and they get their treatment, or they have their treatment shipped to their home countries. Is it right to do? Like, should we be doing it?
Well, as you remember, the stem cells and exosomes we have in our body, and they are constantly renewed. So having that as extra support is logical, and it can be repeated actually.
So it
So
can be lifetime treatment for people who need it.
definitely. I completely agree with this statement. It can be used for long period of time. Let's say 2, 3 months we have done, we can wait a bit and then repeat once again, or do it constantly every 3 months, every 2 months.
Can it be treated for a lifetime? Should it even be given for a lifetime? Like when we think about future of children that have complicated illnesses or cognitive impairment or other issues, because I had a recent conversation and I think it clicks with another lecture I was in. That lecture was about leucovorin, so folinic acid, and autistic children. And what the professor there said is that autistic children have antibodies for folic acid receptors. And it clicked. It clicked in my head because when I look at my kids, I see this constant autoimmune issues coming up. So skin rashes and ear infections and eye infections and lung infections and just general inflammatory issues. So they will complain about muscle pain or joint pain and they're young. They're all under the age of 13. And when I think about what that professor said, and then when I think about the fact that they are responding for stem cell therapy and just to exosome therapy, and it benefits their life, I'm starting to realize this is not a temporary issue. This is something that will be continuing on with them maybe forever. And I'm really wondering, should we be giving this kind of medicine? And this is a medicine, a natural medicine, yes, but a medicine for life for these kids. They're going to be 120, maybe 120 one day. And I think it's a big question.
Yeah, like we from time to time have support of our body with the vitamins and minerals, right? The same we can say here when the own sources of the body is not enough and need something extra, and that is biological, natural product, right? Then we can use it without fear. And for patients, let's say, as for you, you're thinking about autistic kids, and very often when we see patients with respiratory problems, and when there's a tendency for sclerosis of lung tissue, then they, with these inhalations, they have, without possibility to travel or being too weak or anything else, this kind of option with exosomes, it's a very good solution.
Okay, so there you have it. I think it's a lot of information for one day. And we pretty much covered the lab and all the other issues for exosomes. It's been a very interesting discussion, and I'm sure we will continue it on in our next episodes. And if you at home are interested to receive more information about exosomes or stem cell therapy, or speak to a clinician from Swiss Medica, you are more than welcome to click the link below, and a staff member will contact you. Thank you so much, Dr. Alexandra, and we will see you again on our next episode. Bye.
Bye. Have a nice day.
You too.